Orthotic treatment in case of weak dorsiflexors and plantar flexors. Compensating for weak dorsiflexors and plantar flexors when walking. This is the first video in a 4-part series of educational videos. It is advisable to watch all 4 videos in order to fully understand the context. Chapter 1.1. Physiological gait due to healthy dorsiflexors and plantar flexors. When standing, the plantar flexors keep the body's center of gravity over the forefoot. This leads to a physiological knee joint angle of about 0 to 5 degrees. When walking, the heel starts rising up in terminal stance, as the fully functioning plantar flexors are strong enough to lift the body weight. This lift reduces the downward motion of the body, ahead of initial contact of the other leg. During swing phase, the dorsiflexors lift the forefoot. This results in a physiological knee joint angle of about 60 degrees, the leg swinging straight, and a straight posture. During loading response, the dorsiflexors control the lowering of the foot. This results in a physiological knee joint angle of 15 degrees. During mid-stance, the plantar flexors stabilize the ankle joint, and help maintain a physiological knee joint angle of 0 to 5 degrees. Chapter 1.2. Pathological gait due to weak dorsiflexors and plantar flexors. When standing, weak plantar flexors can't activate the forefoot lever. As a compensation mechanism for the lack of stability, a hyperextension of the knee develops. Weak plantar flexors can't activate the forefoot lever from terminal stance. As a consequence, the heel stays on the ground and the body's center of gravity shifts downwards too far. To lift the body back up, the opposite leg has to work harder, which increases energy consumption when walking. A visible indicator of this is a higher than normal knee joint angle of the opposite leg during loading response. During swing phase, weak dorsiflexors cannot maintain a physiological foot lift. The forefoot drops down. This results in an unphysiological knee joint angle of more than 60 degrees. An unphysiological posture. And a circumduction. After initial contact, weak dorsiflexors cannot control the loading response. This results in the heel lowering, not the forefoot. During stance phase, weak plantar flexors fail to stabilize the ankle joint. As a compensation mechanism for the lack of stability, a hyperextension of the knee develops. In summary, terminal stance, the heel stays on the ground. Swing phase, drop foot, hip hiking and circumduction. Initial contact, the forefoot touches the ground first. Stance phase, hyperextension of the knee. Chapter 1.3. Comparison of a pathological gait due to weak dorsiflexors and plantar flexors, and a physiological gait. Chapter 1.4. Comparison of a pathological gait due to weak dorsiflexors and plantar flexors, and a physiological gait due to the correct orthosis. Custom-made AFO with a mechanical system ankle joint using dynamic dorsiflexion and plantar flexion stops with precompressed spring units. When standing, weak plantar flexors fail to activate the forefoot lever. This leads to an unstable stance and hyperextension of the knee. An AFO with a neuro swing system ankle joint activates the forefoot lever, enabling a secure stance and restoring a physiological knee joint angle of 0 to 5 degrees. During terminal stance, weak plantar flexors cannot activate the forefoot lever to counteract the ground reaction force. As a result, the heel is not lifted. The spring unit in the neuro swing system ankle joint is strong enough to lift the heel. Weak plantar flexors cannot lift the body weight, which results in an unsteady and inefficient gait. The difference is most apparent when focusing on the heel during terminal stance. Since the spring unit of the neuro swing system ankle joint is strong enough to lift the body weight, a smooth gait is restored. In addition to a missing heel lift, another sign of an inefficient gait due to weak plantar flexors is a higher than normal knee joint angle of the opposite leg in loading response. Since an AFO with a neuro swing system ankle joint restores a smooth gait, a physiological knee joint angle of the opposite leg during loading response is also restored. During swing phase, weak dorsiflexors cannot maintain a physiological foot lift. This leads to a drop foot. An AFO with a neuro swing system ankle joint maintains a physiological foot lift. A drop foot leads to an unphysiological knee joint angle of more than 60 degrees. A physiological foot lift results in a physiological knee joint angle of 60 degrees. Weak dorsiflexors have to be compensated through hip hiking. An AFO with a neuro swing system ankle joint allows for a physiological posture with a slight hip tilt. Weak dorsiflexors can cause a circumduction. An AFO with a neuro swing system ankle joint enables the leg to swing straight. Weak dorsiflexors with low activity and a shortened step length cause a reverse direction of movement in the ankle joint due to a drop foot, and the forefoot to touch the ground first during initial contact, not the heel. The dorsiflexion assist of an AFO with a neuro-swing system ankle joint enables the heel to touch the ground first during initial contact. The support level can be adjusted through interchangeable precompressed spring units with different resistances. The result is a silent gait with the best possible activation of the dorsiflexors. During loading response, the knee is pushed into hyperextension due to the weak muscles. An AFO with a neuro-swing system ankle joint generates a physiological knee joint angle of about 15 degrees. During the stance phases, weak plantar flexors fail to stabilize the ankle joint. This leads to a hyperextension of the knee. An AFO with a neuro-swing system ankle joint restores a physiological knee angle of 0 to 5 degrees in mid-stance.